addition to just finding a biomarker for the disease, it would help in diagnosis, also potentially helpful in finding a therapy for the disease, and a good way to track the disease progression. Because right now all we have is you come into the office and we make you do things like this, and watch you walk and that kind of thing, which is pretty subjective. So we don't have a great way to track progression. So if we found a biomarker, something maybe in the cerebrospinal fluid, which circulates around the brain, which is where all the action is at for Parkinson's, then maybe we could track it over time and see how it progresses over time with patients and have a better way of knowing where the disease is in its progress. So diagnosis, tracking progression, and also hopefully helpful to find a biomarker as far as finding something to intervene and slow down the disease. So that was the initial part of that study, and that study has gotten bigger and bigger and bigger. So another thing that we have done with the Michael J. Fox Foundation as part of that study is we've looked to identify people that are age 60 and older that have a decreased sense of smell, but no signs of Parkinson's disease yet, because something like 97% of newly diagnosed Parkinson's patients have lost some ability to smell. And that's one of the first signs of Parkinson's for many patients. So if we could identify it before they get slowness, stiffness, and tremor, that would be ideal, especially if we can come up with something to slow down the progression. If we could just stop it from progressing at when you start to get hyposmia and decreased sense of smell before you ever get trouble with your movement, that would be wonderful, right? So that's another aspect of that study, was we recruited patients age 60 and older with a decreased sense of smell, and we're following them over time to see how many of those patients develop Parkinson's disease. Also part of this study is a big genetic area. So we're looking for Parkinson's patients that are Jewish and their first-degree relatives, because there are two different genetic mutations in the Ashkenazi Jewish population that account for 30% of Parkinson's in that population, which is a pretty big deal, because in the general population, we think that genetic causes only account for about 10% of the cases. So this is one of the first huge studies into genetic causes of Parkinson's disease. In addition, this study, the PPMI, like I'm telling you, it's getting bigger and bigger and bigger as the years go by. They've also, not here at our center, but at other centers, recruited patients who have REM sleep behavior disorder, which is the acting out of the dreams at night, hitting, kicking, yelling in your sleep. Because that's another one of the premotor signs of Parkinson's disease. Decreased sense of smell and REM behavior disorder. So same idea, we're looking for those patients that have REM behavior disorder, who don't have Parkinson's yet, to follow them over time and see how many of those patients develop Parkinson's disease over time. So although that's a study where we're not giving a medication, we're still finding out a lot about the disease. So now just to talk a little bit about some research lingo, so some words to be familiar with if you participate in a clinical trial. Has anyone here been in a clinical trial? We got two over there? Somebody over there? Okay. What did you think? How was it to participate?
He's been in about 3 or 4 of them.
Okay.
In the last 20 years.
Yeah. All right. Did you enjoy it?
Yeah.
It's fun.
Okay. Okay.
The thing is, we had to come here like 3 times a week for months and months.
Yeah. Yeah.
That's
Okay.
the hard part.
Yeah, so studies vary, but that's true. Some studies are more rigorous than others. So some studies do require frequent visits, and then there are other studies where you just have to come once a month or once every couple months. How about you guys? Did you guys enjoy participating in research?
Yeah.
Okay. And it's kind of a nice way to feel like you're contributing. A lot of times, I mean, one of the potential benefits, hopefully, is that it may help you. But even if it doesn't help you, hopefully it helps the population of Parkinson's disease patients on a whole. So the informed consent form is basically some light reading, 30 to 40 pages sometimes, sometimes shorter. But basically it tells you all about the clinical trial, so everything you should need to know. What has been tested so far with this drug? What have they found out so far? What are the potential side effects? How many visits will there be? What kind of procedures will be done? So typically in a research visit, we do vitals, physical exam, surveys for you to fill out, get urine samples, blood samples. That's pretty much the gist of it. Sometimes it gets a little more intense, but that's pretty much the idea of it. And so the informed consent will review everything that will be done during each visit and what you can expect. We'll go over the risks and benefits. And schedule and potential side effects. That make sense? So that's basically everything you should need to know about the study before you agree to do it. And then you review the consent form, and we ask you, are there any questions? What more can we explain to make things clear? And then once you're ready, then you sign the consent, and we sign it as well, and we give you a copy to take home so you can refer to that as you go through the trial. So some other words as far as research goes. So the screening visit, usually there's one, sometimes there's 2 visits, is basically the beginning of the trial where we're looking to evaluate whether you're an appropriate candidate. So one of the things that we do at that visit is we would go over the inclusion and exclusion criteria for the study. So every study has different inclusion and exclusion criteria that need to be met in order to participate. So, some of the things, well, for example, one of the inclusion criteria is you have to have Parkinson's disease. Makes sense. But they're very thorough so that they get exactly who they want in the clinical trial. If it's a drug that might affect thyroid, they make sure. Don't enroll anyone that has thyroid problems, or if they do, make sure that they're at normal levels. So that's the screening process, basically evaluating whether or not you're an appropriate candidate for the study. Then the baseline and randomization, so that's typically where you get randomized